to present today's series on the artificial intelligence. Started with the last webinars, Dr. Zaini, and who's the best person to talk about things about artificial intelligence in medical educations than our honorable guest, Dr. Mona Sheikh. She is assistant professor of neurophysiology and medical educations at Al-Imam Abdurrahman Al-Faisal University in Dammam. She's a very well-known figure in Saudi Arabia, one of the pioneers in medical educations in Saudi Arabia and in the region. She is the vice president of Saudi Society of Medical Educations, lectures at the university, and she is very active in the field of medical educations with lots of publications, and she is also heading the research unit at the university. Without further ado, I will ask you if you have any questions to place it at the end of the lectures. And today's webinars, Dr. Mona is going to take us as leveraging artificial intelligence in medical educations and healthcare. The mic is yours, Dr. Mona, please.
Thank you, Dr. Ali. Assalamu alaikum wa rahmatullahi wa barakatuh. I would thank you for your introduction, and I would call myself a medical education enthusiast and a technology assistant learning activist. We started, this struggle with technology assistant learning from the start of the century, and now we have something to play with, which is artificial intelligence. I hope this webinar will be worth your time, and hope you enjoy it and get some, learn something out of it. So I will be dividing the talk into 3 sections. We will talk about educational feedback and AI as a personal tutor. The second part will be about assessment. That's a big section for AI. And the third part is about healthcare. So I'm separating education from healthcare for the time being, although they all are a continuum. So as an introduction, if we just take I will start with a quote. This is by Arthur Clarke, who said that any teacher who can be replaced by a machine should be. So there is a lot of apprehension, a lot of phobia of AI because people think that it's going to replace them. And I've just heard yesterday my daughter's friend, she's applying for this residency program, and she loved radiology, and somebody told her, don't go into radiology. They are going to be replaced by AI. So these thoughts are really, so if we just have a bird's eye view of how AI can change the way we teach and learn, then these are the areas that AI can help us with. It's an intelligent tutoring system. I mean, we are working as tutors. We do tutorials, we do activities, but we are not good enough. We are not there 24/7 for our students. The second thing is data synthesis and analysis. When I worked in the low achiever student committee, it was very hard for us to, pinpoint those low achievers. With AI, we can do that and even predict it before even go into the first quiz. Adaptive testing. Adaptive testing is different from it's a way where the test itself is changing with the level of performance of the students. And the same thing is for adaptive learning. So learning is, the more you are performing well, then they open for you deeper crevices of knowledge. Collaborative learning, and this is an issue which we really need to think about because interprofessional education is a big issue now, and there is a big workshop with the WHO next week about interprofessional learning. So AI can help us with that. If we can go without the boundaries, or we can go away from the boundaries of the space and time. One of the things that AI can help us with is analysis of practical skills. We have a problem with longitudinal compilation of data. If we are talking about programmatic assessment, we have dots and points about each student, but we need to get a line of performance, line of progress for each student, and this AI can help us with that. Learning analytics, again, that's another area which can help us a lot. So we can tell who students are outperforming, which students are underperforming, and how to support each. Item generation and score, and I will have a section at the end specific for item generation and scoring and my experience with it, and clinical reasoning. Clinical reasoning is one of the most important skills that we are graduating our students with. I remember a very beautiful paper by Downing where he said, if we just merely graduate diagnostician, then we have done our job. The opportunities of AI, I will just highlight this one. Efficient exam preparation, timely and effective feedback, analyzing learning trends. So this is one of the important opportunities that AI is allowing us to venture into. The National Academy of Medicine is a non-profit organization with a global scope. It's mainly for catalyzing and improving medical education. They produced a document called The Hope, the Hype, the Promise, the Peril. I really like the title. But the issue about this document is about artificial intelligence in healthcare. And what it says, I'll just take one highlight from there. The promise of artificial intelligence in healthcare offers substantial opportunities to improve patient and clinical team outcomes, reduce cost, and influence population health. So all of these three elements are extremely important. And then there is another document by Loomis, which is Artificial Intelligence for Health Professional Educators, in which it prioritize the actions that we need to do at the moment in order to incorporate AI into healthcare. And what sticks out is develop and deploy appropriate training and educational programs. So this is what we should put our effort into, training. And believe me, we need to train faculty more than students. Students are self-trained, more or less. Now, the American Medical Association has launched in the end of 2023, 7 web-based modules, the first of which is Introduction to AI. So there is recognition of AI as an essential aspect that needs to be introduced to faculty and students alike. Now, this one is an interesting publication, AI and Medical Education, a 24th Century Pandora Box. Now, it's a long article in the New England Journal of Medicine, but what really caught my attention is that if we use AI in teaching and learning, then the thought structures of the learners can change, the schemata formation can change, and the practice patterns of these learners and trainees can change. So these are really essential elements that can influence the way we practice healthcare. In a New England Journal poll that was given to thousands and thousands of medical educators, the question was, what are the top 2 topics that medical schools should focus on to prepare students to succeed? And 34% of the respondents said data science, including artificial intelligence and machine learning. It means that the world has started now to recognize AI as an essential tool for healthcare, and this is very important. So how can we incorporate AI in medical curriculum? Let's look at some examples. This is from Stanford. This was published in Academic Medicine. So they propose that they want to put artificial intelligence at a separate course, which hopefully will get integrated with other courses. But to me, this looks like this. If I had a netting piece, and I wanted to add red color, then it looks so it does not intermingle with the rest of the work. It is really meaningless. The second possibility, and this comes from Michigan, and they say that teaching artificial as a fundamental tool set of medicine. What they propose, this is the actual article by Otlis and Loomis. Again, you see Loomis here. They are proposing that artificial intelligence should be given at the beginning, at the foundation or preparatory year, before the students venture into health sciences, basic sciences, and clinical sciences. Well, that's fine. We are assuming that if they get this basic foundation skill, that they were going to apply it into their future learning. But as we know, and as we have been with our experience, students, as soon as they pass something, just forget about it. So my proposal is that AI should be a theme as across all the curriculum, incorporated in each learning situation, in each assessment tool, so that students will not be able to do without it, because we want them to use it in the future in their practice. Something like this. So that you see how the red color now is weaved into every part of this piecework. So if we want to take a strategic plan to incorporate AI into programs, the first step is to engage the stakeholders. This is what we are trying to do now. So if you are in an institute and you are saying, okay, I want to add AI, and your decision makers do not know about the value and evidence that supports the AI role in medical education and healthcare, then that will be difficult. So this will be the first step. The second step is to formulate learning objectives, competencies, and then assessment tools. This, if we go by this, where are we at this? We already have defined our competencies, and they are here. So competencies for artificial intelligence have already been defined by Regina. And she said there are 5 basic competencies that we need to do: basic knowledge, social, ethical implications of AI, workflow, AI-enhanced clinical encounters, and AI-based evaluation of tools. So competencies have already been defined. What is missing is incorporating them into our program. I came across this book, Using Generative AI Effectively in Higher Education, and our brilliant librarian, Shakil Ahmed, gave me a PDF of it. So I read it. It's a long one, but very useful. And in that, one of the studies, they have chapters. One of the chapters, they looked at the present use of AI, and 56% was about structuring. And what I mean by structuring is, giving templates, outlines, organizing a certain report or output, ideation of research, writing skills, how to knowledge, and feedback. Only 11% is used in feedback. So what this is telling me is that AI is not fully utilized, is not, the strengths of AI is much more than what is right now used for. Now, on page 133 of this book, I found this brilliant mind map, which tells me about how should higher education institution manage the introduction and embedding of generative AI. And believe me, this is the question that's in the mind of every vice president of academic affairs and every deanship of academic development. How can we do it? So there are 5 main steps. I will not go into the details. We need regulation and procedures. We need policies to allow for that. We need professional development. And this is one of the things we have designed an annual faculty development professional program to help or equip our faculty with basic AI tools in teaching, learning, assessment, and research. We need collaborative standards. So you need collaboration from all committees. And a very useful experience in Lebanon was that they took a committee from deans of health professional colleges, and they started putting together how to incorporate AI in an interprofessional way. We need how to engage the students into all these efforts, because students know more, and they can guide you actually and give you insight on what is the best ways. Technical development and support. We need an infrastructure that allows for all of these, for leveraging of AI into medical education and clinical training. So let's talk about how AI can help us in educational feedback. I honestly feel that as educationists, we have failed our students. Our students are always complaining that they don't have enough feedback to their performance level. We do have advisory committees. We do have a lot of mentorship going on, but it's not 24/7, and students feel lost. So just reminds me of the paper by Kees van der Vleuten on driving lesson or driving test. Should we always evaluate? Should we support? And as we know, feedback is the lifeblood of learning. So if you don't have that venous return, you will never have a cardiac output. Now, this brings me back to the story of 3 educational psychologists who sat together and reviewed decades of research on learning theories and educational psychology. And the question they were trying to answer is what makes feedback most effective? And out of all of these factors, you see those 9, the one that stuck as the most important one was trust. And what we mean by trust is that you are trusting the feedback giver that he has concern about your welfare as a learner. And believe me, when I used AI to give feedback about written reports and proposals and essays, the students, they trust AI more than they trust the instructors, because they know the AI is a machine. It does not know, it doesn't have feeling, so it will just be consistently objective to students. This was my Master in Health Professional Education work. We did education and environment measurement. We had this unique opportunity where we had 2 parallel programs running next to each other in our medical school, one medical college. One was the preparatory, the parallel program, which has an innovative, problem-based, system-based, early clinical exposure kind of curriculum. And we had the traditional, the fully traditional program with Flexionarian model, which both were running parallel to each other. And I thought this was a unique opportunity. So I wanted to see how the students in each program perceive their environment. And I used DREAM. And those who don't know DREAM, it's a tool of 50 items that measure the perception of the students about their education and environment along 5 subscales. And one of the items, I will enlarge it in a minute, the teacher are good at providing feedback to students. You see, this is not my results. This is somebody else's results. Even here, the scores are out of 4 because it's a 5-point Likert scale and the strongly disagree is 0. So it is from 1 to 4. So you see, even here, it's very slow. In my case, it was consistently low in both programs. And so it was like 2 point, below 2, 1.5 and 1.6, something like that, between the 2 programs. So we failed our students. We're not giving them enough feedback. And this was perceived. All of the other items, all of them, none of them was below 3. So this is the only item that was below 2, which means a priority, red flag. Then in 2012, our dean told me, I want you to meet with the students of 6th year because we realized that our graduates' performance in SMLE is declining. So I sat in a group with a group of students, males and females, and I asked them, what is going on? What is your problem? And they said, all of them in one voice, we don't get feedback. We don't know what we are doing, where we are going, whether we are enough or fit for practice. Those were very strong words. I said, what is the second factor? And they said, you teach us something and you assess us something else. So they were talking about educational alignment. Students are really ahead of us. But feedback was number 1. Students, in their words, in my educational environment measurement, the qualitative part, they said, we feel we have a blind walk from the day we are admitted to the day we graduate. They said very powerful words. They said, we don't enjoy our studies. We are all the time working very hard to improve our test results. And we just wait for that surprise when the test result comes. And we have fear of failing. So how do some colleges deal about that? Let me see if I can have. Okay. The fear about AI should be limited. And I want to just mention the experience of Harvard Medical University, Stanford Medical University, how they deal with this. And I hope this video will work.
And doing some of the lower level tasks, would have occupied that otherwise in the past would have occupied those positions in the past. It's not that we don't need to start. It's not that we don't need to start. Medical students need to start from the basics. Medical students, I believe they can move more quickly. I believe they can move more quickly, more advanced levels of reasoning, more advanced
with the sound.
that they'll be supported by AI. They'll be supported by AI in the future.
Yeah, there is double sound. It's not clear.
Right. It just seems, what I like about your piece so much
Is it okay now?
seems like this natural evolution. We used to never think we would have calculators in exams, or we would never have, sort of these other types of catalogs of medical knowledge as a part of our exams. And now we routinely accept them because we want our clinicians to be functioning at much higher levels and that higher order thing. So it resonates so much for me what you've written. Now, how do we do that? How are you going to do that at Harvard Medical School?
So our students learn to take a history, they learn to perform a physical exam, and then they learn to write a proper clinical note. And then we ask them to do it over and over and over again to basically instill that into their minds and show us with confidence that they can automatically generate solid clinical notes that are interpretable by other providers. Well, we know that ChatGPT writes pretty good clinical notes if given the right inputs.
So this is how they did it in Harvard Medical School. They encourage their students to learn about AI so that they can, it can help them in writing clinical notes. What I'm trying to say is that the best medical schools are actually encouraging their students to use the AI, and they don't fear that this is going to replace them. So they let their student interact with the patient normally, take history, physical examination, but when it comes to writing the clinical notes, then they try to ask them to use AI, and they make AI available to them actually and encourage them to use it to save their time. This is another
Artificial
video.
intelligence can spark either hope or hesitation, especially when it comes to healthcare. But it's already being utilized right here on the campus and in clinics, from cardiology to ophthalmology. How is AI, the algorithm, used in your clinic?
In the past, when most people think about individuals who care for their diabetes, you're thinking about poking your finger and getting a blood drop and putting it on a meter, but that's not the case anymore. Right now, most individuals living with diabetes, they get to have a continuous glucose monitoring, and it gives them 288 data points in one day. So as clinicians, we're trying to really understand and wrangle all that data, and AI has really helped us do that.
So AI speeds up the process because you get the results in real time and you can reach out to these patients in real time.
As soon as that refresh button is hit on this screen, those people who need the priority, they just go right up to the top. And there's actually a lot of data that shows that when you have technological advances in diabetes, our most minoritized families are left behind.
So the AI has a far better outreach.
So in Stanford University, they concentrated on using it as an adjunct in clinical diagnosis and in lab tests. The video is long. I can leave you with the URL to look at them at your leisure, but I want to just highlight that the best medical schools are actually encouraging their students to use AI, and they have no fear or apprehension against that. You know, when we want to start student-centered learning, we want students to have personalized learning so that they can learn at their own pace, in their own style. We want students to learn without limits. They can learn at 2 a.m. anytime. So you never know when the students have this readiness to learn. We want the learning to be driven by the student, okay? And we want to have competency-based education. All of these four are the pillars of student-centered learning. And we failed to do that. And AI can help us actually in establishing those four pillars. We need collaborative learning, and we need interprofessional learning. At the moment, it's very hard to implement these without the help of AI. So let me just go through some of the tools that can help us establish student-centered learning, or use AI as a personal tutor, which is there 24/7. There is a group of them. So the first one is called Body Interact. And this is an interesting tool. Each time.
Imagine bringing together the real-life pressure of managing patients with the physiological complexity of the human body in a safe learning environment that allows zero harm to patients. Meet Body Interact, the most advanced virtual patient simulator that challenges learners to practice and apply their clinical reasoning, decision-making, and critical thinking skills. Body Interact enables a lifelike interaction with culturally diverse virtual patients in expert-reviewed scenarios throughout an entire patient journey. Pre-hospital care. Assist patients in settings on the street, at home, or in an ambulance.
So Body Interact is a powerful simulator that actually makes the student live in the simulated scene and interact with the conditions, and it works in with 8 languages. It gives them vital signs and all the clinical signs and lab data, and will give them feedback to their diagnosis or initial diagnostic differential diagnosis. The second one is called osmosis, and I love this one as a basic scientist. This one, you choose a certain topic. Let's say I chose hearing because it's one of the things I teach as a neurophysiologist. So it gives you a general baseline information. It gives you some structural anatomy, function, anatomy, and physiology. And then it gives you questions like, what is this structure? So if you say oval window, so it's like fill in the blank for certain structures, and then it tells you whether it's right or wrong, or it highlights that structure and tells you what it is, and then you have to select, and if it is correct, it will give you the green color. If it is wrong, it will give you the red color. And then it gives you multiple choice question about hearing. So for example, a scenario of a 75-year-old man with age-related progressive bilateral sensorineural hearing loss. And as we know, when you lose higher frequency, the higher frequency sounds are transduced at the base of the cochlea. So for the sake of fun, I answered apex of the cochlea. So it gives me red. So then when I put base of the cochlea, it gives me green. But the beauty is that it gives a commentary on the right about why it is, why this is correct, why this is wrong. And so it's beautiful for students who are revising for the SMLE or who are reading their knowledge about a certain topic. Aquifer is another tool for clinical reasoning, which emphasizes the doctor-patient encounter. So it emphasizes how you take history. If there is a question that the student did not ask, it will highlight it. If there is a physical examination that the student did not do, it will also highlight that. So it keeps interacting with the student about history, physical examination, lab tests, and will give the data as the student inquires about it. And then finally, it asks them for the diagnosis and gives them feedback about that choice of diagnosis. Now, radiology training, as you know, is a little bit hard. Sometimes you want your students to be exposed to certain radiological features, but they are not available or they are not clear. And this is one tool that can help us do that, especially in rural areas where they don't have radiological sets. This fifth one is the surgical skills training. This is a very powerful one. It's called CSATs. Here, as you know, students have to do, or residents maybe, they have to do some procedures. So this one, you can watch a procedure or a full operation done by an expert surgeon anywhere in the world, and you can videotape yourself doing a procedure, upload it to a secure cloud, and get feedback on that procedure by an expert surgeon. So it's really a very useful hand tool for those who don't have access to.
CSATs is an AI-driven surgical data management platform that provides consistent and objective expert feedback and clinical analytics designed to improve surgical proficiency. With CSATs, you can efficiently capture and store your surgical videos for future review, reflection, and learning. Using our proprietary interface, you can record, save, and send your videos to our high-trust CSF certified platform. CSATs also offers feedback, insights, and analytics related to a surgeon's skills and technique. View a personalized and private dashboard. Track your performance. Receive unbiased feedback.
So the beauty of it is not only it will give you feedback for the present performance, but it will produce like a progress for you. So let's say a student wants to prove lumbar puncture. So he does the first procedure, he gets some feedback, he does the second one and third one. So the CSAT will give a whole analytics of the progress of this procedure. Are the slides shown, or am I still in the? You can see my slides, right?
Yeah, we can see your slides. Yes.
Good. So the sixth one is called the Intelligent Tutoring System, MidTutor, and the other one, I'm not going to show these, you can see them later. And yeah, MidTutor is for, maybe I can just briefly, I'm just worried about the time.
Shock. So the commonest type of shock is hypovolemic shock, and there are two types of shock: hypovolemic shock, hemorrhagic.
Okay, so it's about a complete revision of knowledge. So it's like giving tutorials to students. It's very good for students who are preparing for licensure exams and international exams. So let me go back and yes, Isabel. Isabel is a beautiful tool which concentrates and highlights differential diagnosis and prioritizing your differential diagnosis based on the specific features of this patient, his age, his gender, his background, occupational, family history, and so on. So the students go on giving the differential diagnosis and up and down, prioritizing the differential according to the information given to them. So it's a really very useful tool. Now, some answering system like WooBot and Talkspace, they have been used in the past as a psychology kind of therapy or for cognitive behavior therapy and these, but they are now used for students to prove their communication skills. So the students, they practice by giving information to a patient, for example, explaining how to use an inhaler or how to take certain medication or how to deal with a certain condition. And the AI will give them feedback on their language, whether they were using it appropriately at the level of the patient, whether they used a lot of jargon, whether they had empathy, and the whole, evaluation of their communication skills. The same thing can be said about breaking the bad news. So the student can practice breaking the bad news using these kinds of tools. So this is about educational feedback. I think with AI help, we can, solve this issue, which has been there since 2010. We were not able to please our students with how much feedback they are getting to their performance. The second thing is assessment. And I'll just tell you from my experience how I use that. Assessment, there are 4 things that I want to tell you about. Tabahuth, research proposal. Tabahuth is a summer research course, but we did it in winter. We just finished. Yesterday was the ceremony. And it's a research course where we tell our students, so this is about assessment. Do we want to increase quality or do you want to judge the quality? And the best is to use it for both. And I want to introduce you to the PAIR model. Whenever you use AI, there are 4 things that you need to do. PAIR, P from a problem. So you formulate the problem, identify it and state it to the AI. Then you select which chatbot you want to use, the best one. They are not the same. So this is why I hate it when they say AI. I said, it's a family, just mention the name. Is it GPT-4? Is it Cloud? Is it Gemini? So just tell me, because they are not the same. They have a difference in their outputs. And then interact with the tool, tell it what you want, and then reflect. So if for example, the AI gave you an item which you think is too easy, tell AI, this is a very easy question. I want you to give me a question that tests higher cognitive domains or more deep knowledge, because these are, senior students or something like that. So reflect, and the AI will actually try to please you. Now, this I took from LinkedIn. There is, she's a PhD, Amina Yunus. I follow her, and she has done a lot of work with AI as a master and as a PhD student. And I was following her throughout her journey. So this was the very recent prompt, maybe last week. She said, if I want to answer an essay, then I just use this prompt. I need to answer an exam question, and I want to structure my response to achieve the highest possible grade. The question is, and she puts the question there, and then she says, please help me create an A+ response structure by, look at how many things she put in the prompt. She literally put 6 things. The first one, she says, provide a brief analysis of what the question is. This is exactly the prompt that she gave to the AI. Provide a brief analysis of what the question is asking, including key terms and how they shape the response. Then she says, outline how to craft a strong introduction that directly address the question, establish the argument and outline the main points. Then she talks about the main body. I want the key points, supporting evidence, how to link each argument back to the question. Then these are all prompts given in one go to the AI. Highlight where and how to include critical analysis, because she wants to show her expertise, counter arguments, and evaluations for maximum marks. Then explain how to write a conclusion, summarizing the argument and reinforcing the question's answer, and share tips on using clear language, structuring paragraphs, and integrating examples, theories, or data effectively. She used all of this in a prompt, and she specified the question, and at the end, she said, please structure the response to meet academic standards. And she got the best of response. So how, this can be an excellent, we are not expecting the students to use this during the exam, but at least they can use it as a training, so they know how to best answer a question. When we talk about item generation, we want the AI to help us create higher cognitive domains items. And let me now tell you about my experience with AI in assessment. So Tabahuth is a research summer course, but we did it in winter this time. It's a flip kind of course. So students are exposed or are given 5 basic lectures, which are recorded in the as video in the studio and the e-learning deanship. And we measure the cognitive gain by doing pre-post test using Socrative. And we share with the students the Padlet. So there is a shared platform between us and between the learners. I don't know if I can show this. I need to share again. So this platform is shared between all the learners, so they can put their expectation, queries, illustration to each other. It's like peer teaching and feedback to us as well. And we find this very useful. So how is this related to AI? The issue is about, we need at the end to give them, first of all, we use AI tools in research. So SciSpace is one of the best tools I have used because it helps me with idea generation. So it determines the gaps and it gives me an idea. Maybe I can show it quickly here. I don't know how we are doing.
So SciSpace Copilot is an interesting AI tool that has been incorporated into SciSpace to help you research more in a better way. So you don't have to be navigating around different tabs, searching or Googling different kind of concepts or ideas. With SciSpace Copilot, you can be able to do everything from summarizing a text to rewriting or prompting it with different kind of questions that has to do with a particular research paper that you're working on, to even understanding and explaining equations and concepts, even tables. It goes beyond equation to even tables, and even you can explain any given picture or image for you within a particular paper by just highlighting it. It will explain everything.
So you really have to look at it because I think it's a very, the services within this tool are really remarkable. So what we do is it helps us in formulating the research question. And once you put your research question in the search bar, it will give you all the literature that has been, that it search for you. The literature gives you all the articles in PDF format, and it gives the table of like the summary of each like the introduction, the results, the discussion, and it gives you a summary of the best 5 articles that fit with your research question. So the way we do this research course is we do flip. So they look at the flipped classroom kind of strategy. So they look or they learn through the videos. They come to do activities. They work in groups with their mentors. So there are like research interest groups. And we end up, with 16 research proposals, and we create research groups, and we get the learning needs of the mentors, and all of these are the outcomes of Tabahuth. But the issue is that the 16 research proposals have to be scored and given within 1 day or even half a day, because there is a ceremony the next day to determine the 3 best proposals and, to acknowledge them. So when we did it last time, we had a cognitive gain of 30%. And the students said that this is because of the lectures, the activities, and the practice in the class. Their qualitative description, they said we changed from complete confusion about research to clarity. And AI helped us in creating the rubric with which we can evaluate the proposals. So we used this rubric, and we evaluated the 16 proposals. At first, we had a lot of doubts about how reliable and how consistent the AI is. So we attached the rubric that was already created by AI, and we attached the proposals, and we asked the AI to evaluate, and we repeated each 3 times. And we found that the scores were very consistently within plus minus 2%. Then we put a human judge, 3 judges for each proposal, and we found there is high correlation between the human scoring and the AI scoring. The value of the AI is that it gave a narrative feedback. Judges did not have time to give me any evaluation, so they actually gave a narrative feedback of strengths and weaknesses and areas of improvement for each section of the proposal. So that was very helpful. So for those who did not win, they knew which part they did not do well. So the benefits of scoring essays is it's faster, it's consistent, it's scalable, meaning that I can do a large number of essays in a short time, and it can improve, the AI can improve itself about essay grading the more you use it. I used it also for the biomedical technology master students. They were supposed to present a report of 20 pages at the end. And I had only 3 students. I was afraid that I'll be subjective because one of them was very active during the class. And so AI was, I corrected the reports myself, but then I wanted AI as a second opinion. Like I want to make sure I was not being subjective or, being more inclined towards one of the students or the other. Now, when we use AI as an item generator, we need to give a very clear, concise job in the prompt. So we have to describe who you are, who your students are, what is the context in which you are doing this assessment, what is the output format? Do you want it in a word? How many word count? Is it an A type, R type, script concordance? How many options are there? Is it a high cognitive domain? Is it case-based? So you have to be very clear about the format. Ask the AI if they want any suggestions. Now, this issue here is a very recent one, which I have seen in a paper that's not yet published in the preprint format. When we combine ChatGPT with an automatic item generator, which has embedded illness scripts within them, then the output is much more clinically sound. So you are testing for key features, for main concepts. And then you can attach as well the course objectives, CLOs, and ask AI to generate, for example, 2 questions for each AI. So the blueprint is done automatically. And ask AI itself for any additional details needed for your prompt. So if you follow these 7 things, you are sure that your items generated by AI would be of a high quality. So if I want a case-based question, I need to tell it about the desired format, the patient details, patient campaign, relevant clinical history, and physical examination finding. And then I ask it, write a case-based question on a diabetic patient, for example. So the prompt has to be clear and concise. Right, so how do we use AI in healthcare? if we just sit back and ask ourselves, what are we failing to do as physicians? What are the main challenges that we are really facing in our healthcare in general? Then the sources of error in healthcare are either lack of communication, that the physician does not obtain a very pertinent history information, occupation of the patient, family history, drug history, or he misses a physical sign, and this is a human. I mean, we can fail. I've seen a doctor who treated the patient and the patient had amputated legs and he did not know. Lab data, we can miss lab data or misinterpret lab data. Or we produce a management plan that is not personalized to that patient. So any of those, AI can safe assure all of them for the safety of the patient and for minimizing the error. So precision in diagnosis, evidence-based reasoning. So the best evidence that we have now, what is the treatment and what is the diagnosis and what is the treatment for this patient, and critical thinking development. I can add to that prediction and prognosis. So we can tell the disease before even the symptoms start. So machine learning is about AI models. So you enter all your patient data, radiology, blood test, and genetic information. And what the machine will give you is precise diagnosis, personalized treatment options, prognostics. And if you have this AI model, then if you can enter any information from a subject who is not a patient yet, and the machine can predict how much this subject is likely to be a patient of a certain disease. So prediction, I think, is one of the best AI advantages. This is a study that we have done on COVID-19. We started in 2019. We were collecting all these X-rays with a ground glass appearance, and we found that a lot of the radiologists failed actually to differentiate between ground glass appearance, pneumonia, and other fibrotic changes in the chest. So we collected like 150, 250 X-rays, but then we found that machine learning needs thousands and thousands. And luckily, a library was launched with tens of thousands of CT scans and chest X-rays of the chest. So we did this study, which is multi-class deep learning architecture for classifying lung disease into normal, pneumonia, and COVID-19. And this was the work image dataset. We used the library, which is called AlexNet and VGG16Net. And the thing that we did differently, so the basic output was the machine will tell you this is normal, this is pneumonia, this is COVID-19. The thing that we have done, which allowed us to publish this in Nature, is that the image enhancement. So we used fractional calculus algorithmic model to enhance the image. And this improved the precision to 98.6 or 98.8, 98.6 for X-rays, 98.8 for CT scans. So we were very proud of this accuracy level. This is study that was done on large LLM's influence on diagnostic reasoning. And they concluded that LLM alone demonstrated higher performance than both physician groups. So they had two physician groups and they had the LLM and compared both as to the accuracy of their diagnosis. So they found that the LLM was higher performing than both physician groups. And they concluded that we need technology to be incorporated into the workforce. But they said that also the LLM did not necessarily enhance diagnostic reasoning of physicians beyond conventional resources. So we need to develop the LLM to be actually, but it is developing as we speak. Now, this is an interesting article from Tokyo, a very recent one. And it says that if you use the prompt, this is a quiz, it makes a difference in the output. So what they did, they used, they produced like a case of the week. They gave archives of cases, 150 cases. And when they exposed those to ChatGPT 4 or Cloud 3.5 with this is a quiz or without this is a quiz, they found a difference. What they asked the machine to do is differential diagnosis and primary diagnosis, differential diagnosis, and differential diagnosis too. And they found there was a significant improvement in the output when you added this is a quiz to the prompt. Why? We don't know. So are there ethical issues? Yes. Bias is, machines do not know people, so they cannot be subjective, but they are biased by the data that you enter into them. So if you, for example, enter multiple sclerosis patients and they are all females, or 90% of them are females, then the machine will learn that a female is more likely to be a multiple sclerosis patient, although it might not be correct. The other one is that there is lack of transparency. We don't know what goes on inside the machine. Although, when I use the machine to, for example, calculate sample size in research, it told me which formula it uses and how they applied it to the research. The context in the real world, so the human touch, and these are the limitations of AI. But believe me, whatever we say now is going to change tomorrow. So AI is developing faster than we think. Things are going to change. It's going to be an essential tool set for every educator, for every learner, for every health provider. And some work, very nice work about cognitive biases in AI-powered healthcare, and they have characterized 10 types of biases. For example, they said that there is overlying, they call it AI over-reliance syndrome, meaning that people will stop using, even in emails or even in the chat and the WhatsApp, if they want to write anything, they will use AI, automation, bias print, and all of this. So I leave you to go through them. So a lot of work is being done into identifying these issues. But the take-home message, AI is here to stay. We cannot ignore it anymore. AI does not replace human judgment, so don't worry, you can go into radiology. Teachers and learners should be trained to use AI. Maybe we should worry about the teachers more than learners. Generative AI can transform the way we learn and assess. And with that thought, I will thank you for listening.
Thank you so much, Prof. Mona, for this wonderful talk and very much enlightening and evidence-based topic you discussed about leveraging role of AI in medical education. And I'm sure that participants must have enjoyed a lot, because there are a lot of questions and good number of participants we have today. Talk was truly highlighting the importance of AI, and especially you shared your experiences, what you have used in your own practices, and definitely it will transform medical education and healthcare system. It's time to take questions now. I can see that there are a few questions in Q&A as well as in chat box. We will prefer to have questions in chat box. I can see there was somebody raised hand as well. So if somebody want to comment or question, please feel free to raise your hand, unmute. Yes, Sayed Kazmi, and let's start taking our questions.
Okay, the mic is yours, Mr. Kazmi.
Okay.
Go ahead.
Okay. Now is it audible?
Yeah.
Yes, yes.
Yeah, okay. Okay, just I want to know, because we are there in the medical college and we are assessing the students through various assignments. I just want to ask that how can we use the AI to assess an assignment, and which AI tool is best? Because students are writing the assignment by hand. So is it practical? Can we assess the handwritten assignments?
Yeah. I
So,
have tried it
yeah,
actually last week with the neurosurgery residents. We have, you know, a collaboration with the Royal College of Canada. So they write the answers handwritten, and we take a photo of that. We attach it to the ChatGPT-4, and we put the model answer, and it will score you. It will score it for you. You can either use a model answer, or you can use a rubric, or you can use keywords. So whichever way you find more. And whichever way you want to use the assess, but it actually assesses handwritten items, which is, you know, in our school, they started doing now the web-based, you know, like the students, they will type it, then they do some automated kind of scoring. But why add some additional variables? Some students are better at typing, so they will use the time in a better way. It's not fair, I think. So even handwritten can be assessed by AI.
That's the benefit of text to speech, speech to text.
Exactly.
Good. So yes, Dr. Samina Malik, we can take your question next.
Thank you so much, Dr. Monal Sheikh. It's always a pleasure to learn from you with so much clarity. I have 3 questions. Firstly, about which AI tool we could use for creation of a rubric. Second question is that what was the other communication skills AI tool other than Talkspace? And third one is which model did you use for enhancement of radiological image? Thank you.
Thank you, Samina, for being there. It's so good to hear your voice again. For the
Please.
rubric creation, ChatGPT-4 and Gemini are the best. For the 2 communication skill tools are Woobot and Talkspace. But I'm sure there will be newer tools, but these are the ones I came across when I prepared this talk. So Woobot and Talkspace, strangely enough, they were used for psychology, for kind of psychotherapy, but they were found by chance to be also useful to prove the communication skills of our students. As you know, communication skills is a key factor in patient outcome, and we find that we have little training for our students, not enough. No matter how much we claim, we still find that we don't have enough. And the AI is, these tools, they give objective, timely, comprehensive feedback to the students about their communication skills, which can be done at their leisure. What was the third question, Samina? Malish, there was a third question, right?
Hi, thank God I can unmute myself. So the third question was, which model did you use for the radiological image enhancement?
Yes, it is called, let me just remind, the radiology is called Radiology Readiness Assessment. And it's used for not only undergraduates, but also for residents. It's used for residency programs as well. It has very good, high resolution radiology. I can actually, let me see if I have the URL.
Yeah, if you can share links to this in
Yes,
chat,
I can share
really
the
good for everyone.
and yeah.
Thanks a lot.
The next, Dr. Razia Aftab. Yes, please, you can ask your question.
Hello.
Hi.
Yeah, can you hear me?
Yes.
Assalamu alaikum. I just wanted to comment that was a very informative and a very nice presentation. But I have a feeling that it is just for the beginners, a helicopter view. Can we have some more for teaching purpose, especially for those who are involved in imparting knowledge to students and helping them? We need to have 1 or 2 more workshops where you can hand-on show us that how you can use some of the very important this AI engines.
I totally agree with you. And we need the hands-on where each one of you have their laptops and we go on and we create prompts together and see the output and we evaluate that. That's very true. Actually, in my school, we have an annual program for AI. use from, we are going to start now. The design is there, but we are going to start implementing it. So you are totally true. Unless we do hand-on, it's not effective.
Yes, Farida Habib, we need to be quick to take question. I can see a lot of excitement is there to ask question, as well as there are some questions in chat box. So yes, please, Farida Habib. Can you unmute, please?
Assalamu alaikum. Can you hear me?
Yes.
Yes.
Yeah. First of all, I belong to the University of Hyle. Thank you very much, Dr. Mona. It was really very informative. So I have a couple of questions. First is that the assignments that we give to the students, I believe that 80% of the students, they do it by using AI. So can you please tell how to check that plagiarism through AI? Second question is that, don't you think, Dr. Mona, that the AI, no doubt, there are countless benefits, but it has affected the critical medical writing skills of the learners? My third request is the same as Dr. Shazia has asked you or requested you. You kindly conduct hands-on activities so that we learn and do the exercises. Thank you, Dr. Mona.
Thank you. Thank you for coming. I think, Doctora, for the students use, there are Turnitin can figure it out, and there is ChatGPT 0, which is free. I have used it myself, and I tried it myself. Like I wrote something on AI and I put it to it clearly told me this is 100% written by AI. So, but there's a big but here, because the issue is there are tools to humanize the AI output. So now the people are very clever. So they take the text written by AI and they send it to a humanizer, and it actually changes it in a way that will look not AI written. So it's very hard. But one thing you can do is ask AI to create an activity or an assignment which cannot be answered by AI.
But that's very difficult, Dr. Mona, because I'm a teacher in a medical university. So what is necessary for the medical students is that they should have they should be competent in writing medical reports by themselves. So
let me ask you a question. When you ask the students to write an essay, do you penalize them for their language?
Not here. Not in this. Yeah.
So if they use AI to help them proofreading or proofwriting, then there is no harm. You just want to know that they have the knowledge, they are using, they are presenting the ideas in a suitable way. So AI is doing the part that you are not penalizing them for anyways.
Yeah, thank you so much. I think we need to keep and be mindful about the timing as well. So quickly, I will just address two questions which are in Q&A box by Dr. Syed Isam and Karimuddin Saleh, that how can individuals and organizations address the challenges to reduce critical thinking and reasoning skills development and accuracy caused by over-reliance on AI? And that question is much aligned with other participants' question as well, that how to deal with all of these challenges, as our previous participant asked about plagiarism issue, and over-reliance on AI is one of the biggest challenge. So how are
yes, actually, I find AI is a good tool to build clinical reasoning, because the students sometimes they fear even suggesting a diagnosis, but here they feel safe with the machine. They can tell anything and they get detailed feedback on why their suggestion was wrong or right, what should they have thought about. So it's available for them all the time, instead of waiting for the bedside teaching where there are 10 or 12 colleagues with one consultant or one resident, and they probably don't have much chance to use their critical thinking. So I think AI is going to help students if they use, for example, Isabel. Isabel is a very useful tool in just prioritizing the differential diagnosis. based on this particular data of the patient.
Another very quick question and quick answer should be there. Dr. Asma has asked that. Thank you, Dr. Mona. I need to know more and give some suggestion that how we can introduce AI in medical curriculum, in courses, how we can integrate within each module.
And this is a beautiful question, and the answer needs another lecture. But I think my best answer to you is that we need to go from the regulatory bodies, start changing the competency framework matrix, changing the PLOs, the graduate attributes, and having an element of AI in each course. So each course should have an element of AI, or each learning situation should have an element of AI. It's a tool, it's not content. So it should be incorporated into everything we do in the medical school and in the residency training as well.
Yeah, thank you so much. I think we should end our question and answer session by now because questions will never end, and there are a lot of things ongoing in our mind. We want to know more. That's why we kept another session on AI and personalized health professional education on 28th of January. So please do join us with us. You can see that we have portrayed the brochure over here. And with this, I will end this webinar by saying thanks to our speaker, Dr. Mona Sheikh. It was really wonderful seeing you. And this session is being recorded, and we shall share recording of this session with all participants. And huge thanks to quite good number of participants today for the session. And I'm sure that you will be happy to join us in next coming session as well.
Thank you
So
for the opportunity, Shazia and Dr. Ali.
Thank you very much, Dr. Mona. Thank you for all participants, and we are really eager to see you in the next webinars. Me and Shazia, we promise you that we are going to make our webinars more exciting in the future. So, I promise Dr. Mona, she will be back again for sure. Thank you very much.
thank you very much. Bye-bye. Have a great
Bye-bye. Thank you very much. Bye-bye.
Allah Hafiz.